I feel my left arm itself is actually the first 3 fingers numbness, and it actually affected my sleep because at night if I happen to sleep on one side itself, the numbness is very annoying. I would be waking up from my sleep.
I got a symptom that is numbness on my both leg. So I went for the X-ray. They found that my spine is a bit not straight, curved, and the disc is worn off. Degeneration of the disc.
The problems that I first started experiencing were kind of pain across my shoulders. It was quite difficult for me to sit up or move, to get out of bed in the morning. The problems got kind of spread a little bit. I started to get what felt like nerve pain down my left-hand side, particularly my left arm. When I tried to raise my left arm, I would get kind of pain all the way down my left side. The main activity that I do that was compromised a little bit, I like to cycle.
Now I no longer feel the numbness in my left arm or my fingers itself, and it doesn't reoccur anymore. It used to reoccur, but after a prolonged therapy itself, the numbness is not reoccurring.
My pain is less.
I don't have any pain any longer. I'm back to all my main activities.
DT standalone is a very effective treatment. However, mixed with chiropractic care and also some supplementation exercise, DT alone is a component of a treatment mixed together with the chiropractic care to get your spine moving better, to correct the subluxation, and to get more fluid back inside your disc.